The carotid arteries are the main arteries in your neck that supply blood to your brain. Plaque accumulates inside your arteries as you age, and if too much plaque builds up in your carotid artery, it can cause the artery to narrow or become blocked, which can lead to a stroke. While medications and lifestyle changes can reduce the risk of stroke for some patients, others need surgery to repair the blockage. Until recently, this required an invasive surgical procedure, but Camden Clark's Dr. Dan McGraw has brought an innovative new, minimally invasive technique to the Mid-Ohio Valley that is reducing the risks.
TCAR is a new carotid stent system. Carotid stenting was underway many years ago, but the problem with carotid stenting was you always had to cross the lesion with the stent, and that always had the risk of knocking the junk, the plaque and thrombus inside the lesion off and sending it off to the brain.
I've been in the cardiovascular business for almost 20 years, and I haven't seen an innovation like this in vascular surgery probably since the mid-90s. So when we talk about the carotid, it's kind of the last frontier in vascular surgery until now. So now we have developed a technique and a procedure where we can safely do an endovascular procedure on the carotid. We are going to change the standard of care. Right now, the gold standard is a carotid endarterectomy. We believe that this technology will replace at some point a carotid endarterectomy. And so a surgeon can say to the patient, here's what I can offer you for your problem. You can have surgery, or you can have this new procedure called a TCAR. I can do them both equally well. The TCAR is much less invasive, can take me less time, and the recovery is much easier. Which one do you want? That's where we believe that this can go.
They did an ultrasound of my carotids, and I was able to watch while the ultrasound was being done. And as she was doing the ultrasound, I said, "Oh my God." And she says, "You can see that." And I said, "You can't miss that." And this was my right carotid. And it was a pretty significant blockage.
Well, carotid disease is very common. It's the most common operation performed by a vascular surgeon. We do 125 to 150 here a year. And we have, unfortunately, a population has a lot of risk factors for vascular disease, including smoking, hypertension, hyperlipidemia, high cholesterol, diabetes. So we have a population that has a lot of risk factors for arterial sclerosis, atherosclerosis, and the carotid artery is one of the very common places that that disease process occurs.
First operation was actually the endarterectomy, where they go in and clean out the artery. And I figured I'd be good with that. They put me on medication. My cholesterol's never really been that bad. I went in for my 6-month checkup, and they did the ultrasound of my carotids again, and the right carotid was again clogged. And after that procedure was done, Dr. McGraw told me I was going to have surgery again, and he was telling me about a new procedure, and I actually volunteered to be one of the first. Told him I'd be his guinea pig.
We have reached out to WVU Medicine, Ruby Memorial, and Camden Clark because of Dr. McGraw. Dr. McGraw is an extremely well-trained vascular surgeon that has done a lot of carotids in this community, and he kind of embraced this technology, and he has done a fair number of cases with all with good outcomes.
I think it's going to be easier on patients to get through. It gives us another tool to approach the disease with. So I think, as with everything, the more tools you have in your toolbox, the better you can tailor individual care to different patients.
I woke up the next morning, I was able to eat breakfast, I felt fine, other than a little bit of pain, which lasted only a couple of days, and was able to go back to work within the week. So when I go back for my next checkup, I'm hoping that he had to do a stent. So hopefully with the stent and this new procedure, I won't have to go through this again.
When you have carotid disease, there's basically two options. You can have a carotid endarterectomy, which is a very, very good operation. It's been done for a long time, but there are some complications associated with it. The other situation is you can have a carotid stent placed if you're a high-risk surgical patient. So if you're a high-risk surgical patient, you can't have a carotid endarterectomy, you have to have a stent. But what they do is they go in from an access point in the groin, and there's a lot of complications associated with it. So many so that, you know, Medicare and insurance companies didn't pay for it for the last 15 years because they were causing more strokes than they were preventing. So Silk Road came up with a flow reversal system where we don't touch the arch, the aortic arch, because that can be diseased, and we don't touch the lesion before we're reversed or before we're neuroprotected.
The patients whom we really have thought about for this are patients who've had prior neck surgery, have had prior carotid endarterectomies. Irradiation to their neck for laryngeal cancer, for instance, makes patients very difficult to operate on. So those patients are ones that absolutely benefit from this. But this is applicable, unlike carotid stenting in the past, this is applicable to a much wider population who have various physiologic and anatomic risk factors.
And you know, Medicare is paying for it, private insurance is paying for it, and we've had the lowest stroke rate associated with any carotid procedure ever. So it's done very, very well so far.
There are only a few hundred surgeons in the country right now trained to do it, so we're on the cutting edge of that.
I'm hopeful that I'm not going to have a third surgery. But if I do, I know I'm with the best possible surgeon I can have. And I'm grateful that I can stay in my hometown.